Hi, I'm Krista Thompson, and I'm the Vice President and General Manager for Global Health at BD.
And what is BD?
BD is a healthcare company, and we make a whole range of products and services from medicine delivery devices to diagnostic equipment that are used all over the world.
As you know, the World Economic Forum recently launched their online handbook for health systems management and leadership strengthening. This is something that BD was very involved in. Why did your organization decide to engage with the forum on this project?
Well, BD has worked with the forum for a number of years, and we've been very interested in this whole concept of health system strengthening and really involved firsthand with this work. So when this opportunity came up to be involved with this particular partnership, we were really excited to see that. And I personally was very interested in this idea that the private sector does a lot in terms of training its own employees on how, management skills and leadership skills. So this seemed like a great opportunity to think about whether the private sector could work with the public sector in these same areas.
What were some of the things that you learned personally from this experience?
I learned a lot personally from this experience, but I think one of the greatest things that I came away with, which was a much deeper appreciation for all the challenges that really face public sector employees. And I just, I have to, my hat's off to them, because here they are trying to work to really improve the health care and the lives of their fellow citizens, and doing that in a very resource-constrained environment, a lot of political bureaucracy, a lot of difficulties. And probably another thing that I really have a much greater appreciation for is that sometimes the people that are there to help create almost as much complexity as they, all meaning well, but they have to deal with all the donors and aid providers as well. So it's a very complex environment that they're working in.
Having gone through this, what would you say to your private sector colleagues out there about what companies have to offer to help strengthen healthcare systems?
Well, I really think that, first and foremost, I want to be very clear about this, I would never say that private companies or the private sector can go in and tell the public sector how to strengthen their healthcare systems. That's not what this is about, and we would never presume to do that. But people are people, and there are management needs. You're dealing with complex organizations, and a healthcare system is a complex organization, just like large private sector companies are complex organizations. So I think that there is a lot that the private sector can help with in terms of management skills and leadership skills, some of which may be very applicable to the public sector. And by working together, they can decide what's applicable and what's not. And I think that there's a lot that private companies have to offer. So I'll give you an example, or just conceptually think about this. Private companies spend millions of dollars training their managers, training their leaders, leadership development, leadership training, and they've all got kinds of materials and different ways that they do that. The public sector may not have access to all those same consultants. So in this way, the private sector is turning around and kind of sharing that information that they've paid for and gained over many, many years. And just like we deal with consultants and we take some of that information and we decide what we want to use and discard the rest, maybe the public sector can do the same thing. They can take some of this information and say, hey, that's going to work here, or that's not applicable to me. And I think that's fine. So we had a really great example of that where we had brought some of the leaders in the Ministry of Health to our corporate headquarters in New Jersey. And we were doing some training and work around a particular process. And during that, they became very interested in a piece that we had on team building. And they said, well, they're very interested in team building. That was a big need for them. I'm like, oh, okay. When we were able to walk down to our training center and get a whole bunch of materials on team building. And so it was very easy for us to just share that with them. And they were really, really happy with that. So just like anything else, it's needs assessment, it's relationship building, it's finding out what is needed and being willing to share, what you have. And I think it's a great opportunity.
Thank you very much.
Great, thank you.